You'll mute now.
Good afternoon. This is Sue Boardman and Jonathan Bomer from Puzzle HR. We're looking forward to presenting our webinar today. We're going to wait till 1 p.m. to start the webinar so we can make sure that all those that have registered have the opportunity to log in. So we'll try to start right at 1 p.m. sharp, and we thank you very much for joining us today on preparing for the restart of opening these businesses back up. Good afternoon. We're going to start our webinar momentarily. Thank you very much to the Textile Care Allied Trades Association for inviting us on to be able to present to you, preparing to restart your businesses. Today, Jonathan Bomer and myself, Sue Boardman from Puzzle HR, will share with you best HR practices in the area. And we'll give it just another 30 seconds. 2/3 of those who've registered have already jumped on the webinar. Thank you. Good afternoon and welcome to the Puzzle HR webinar on preparing for the restart. We're very, very appreciative of being asked to represent Puzzle HR and to talk to the Textile Care Allied Trades Association members about different issues pertaining to the COVID-19 crisis. I'm here today with a partner at Puzzle HR, Jonathan Bomer. Jonathan has 20 years experience here in HR, and I've worked with him for most of those 20, a very large depth of information and knowledge when it comes to HR and businesses, and he's been a wonderful advocate for businesses all around best HR practices. My name is Sue Boardman. I have been in the HR industry for 30 years, have worked for 3 different companies in that area, and have some expertise in HR along with the technology associated with it. And we look forward to spending the next hour with you talking about restarting your business and being prepared for it. Okay. The first thing that we need to talk about today is the legalese. This is not legal advice for your business. We're not representing ourselves as attorneys for your business. We're both HR professionals and applying HR best practices to everything that we talk about. We want to start today because we're talking about reopening in what we're doing. And you know what? Let me take a step back. What I'd like for everybody to see at the bottom of their screen is that they have a Q&A and they have a chat box. Please use the Q&A for any questions that you may have during our webinar. Jonathan and I will try to save some time toward the end of it to get to your questions and get those answered. Today, we're really going to focus on the restarting your businesses and what needs to be done on that. But if there are questions around the PPP loan, which we always seem to get to, we want to make sure we do our best to get those answered for you also. So please use the Q&A box at the bottom. Please don't use the chat. Thank you. So with no further ado, on the PPP loan application, Jonathan, this came out. This was part of what they signed when they applied for the PPP loan. And what I think a lot of business owners didn't realize is what exactly was on the last page of that, a loan application.
Yes, Sue, and it's nice to be with everybody and all the member companies today. We've been through the PPP loan process with many of our clients all across the country, and have processed ourselves many of those PPP loans and are working with all of those member companies of our other associations on the loan forgiveness provisions. And to your point, one of the things that many of our member companies had questions about was related to exactly what they were signing off on. And you get to the bottom of the PPP loan application, it does indicate that we are attesting and certifying that we will be in compliance with all federal labor regulations, to include the OSHA law of 1970. And we're going to talk a little bit about that today, but we need to make sure that as we reopen our businesses and we have employees coming and going into the business and the public dealing with us and vendors coming in, there's a lot behind OSHA. And we're just realizing how active OSHA is going to be with the CDC's guidance on employers providing a healthy and safe workplace for all employees.
And then also, Jonathan, the Civil Rights Act and how that's going to play into the forgiveness portion of it and the expectation for business owners. So as it pertains to the equal employment opportunity, both all the communication, the postings, and the procedures with businesses to be in compliance with it. So on their PPP loan application, the expectation was that they were going to bring themselves to, if not already there, complete compliance with OSHA, along with the Civil Rights Act that incorporates equal opportunity.
And you know what, Sue, it's so important that we all recognize that if we have taken a PPP loan, for all intents and purposes, we are giving our employees federal money for the period of 8 weeks. So in an indirect way, we're not saying they're federal employees, but it's almost as if you're operating as a subcontractor or a federal contractor and are in business with the federal government. So that's pretty standard for any business that has a federal contract, and many of those people might be on the call today.
Right, absolutely. So in starting the webinar, the business unusual and human-focused restart, there's so much that goes into that as people are coming back. Fear is playing such a big play in employees going back to work, and the expectations of business owners, where a lot of the people that we've worked with or we've talked with didn't necessarily have a lot of different things in place when it came to HR.
Yeah, correct, Sue. This really snuck up on all of us. Now, you know, we've had pandemic movies like Outbreak since the early 1990s. And I guess at some point we should have, you know, assumed or expected something like this to occur. But there's no question that this took us all by surprise. And, you know, at the end of the day, all of us want to be able to provide a safe and healthy workplace, you know, for our employees. And while this has been a major economic disruption and it's cost millions of jobs and threatened many of our businesses, I do believe we're going to come out of this better than we went in. And everything we're putting in place today for COVID-19 is part of COVID-19, but it's also to prevent any pandemic from ever shutting down our national economy in the future. So we're paying very much attention to what the CDC is saying, what the federal government is saying with OSHA, as well as all the states that are rolling out their reopening plans. And they're following pretty much lock and trace with what the federal government's guidance on this is. But there's going to be a lot coming out. We're monitoring it every day.
And so with the OSHA guidance, one of the things that business owners have to think about is how to keep their employees safe. You know, in the past, it's been how to make sure that we're using the machines properly and the safety equipment to the machines, so on and so forth. But infectious disease now has come and is a big part of all of this.
Yeah, truly, there's no question. Having been in the business for 20 years and worked in and around workers' compensation insurance and workplace safety, we've always asked those questions. Like, for example, does your business have aluminum dust? And we're going to talk about some engineering controls today. We have delivery people who are going out and delivering things. Are they safe on the road? Up until 2020, it was pretty much your standard workplace safety, guards on machines, slips and falls. And now we're really kind of in unprecedented and uncharted waters. Workers' compensation has historically never included any ordinary life disease, such as colds and flus, as part of workers' compensation. If you did get some kind of an occupational disease like mesothelioma, going into the mines, or there was some other disease related to your occupation, those may have been covered. But up until now, there's never really been any conversation about if I got sick at work for an ordinary life disease, would that be a workers' comp claim? And while the stance today still is from the federal government and the states that no, it's still an ordinary life disease, we are monitoring this because there's a lot of discussion happening behind the scenes.
Absolutely. And then when it comes to OSHA, OSHA is a federal government. But what we're seeing is the need for business owners, and how confusing is this, is layering in their own state plans. So can you share a little bit of your thoughts around this slide?
Absolutely. And OSHA as a federal government agencies, and we have a lot of federal agencies, Department of Labor, Department of Treasury, Department of Defense. OSHA is the Workplace Safety Administration. And typically what happens is when they put out guidance, either in general or industry specific, you'll typically you'll see the states follow pretty closely to what they're saying, but then they'll make their own independent changes. So if you were to go to the whitehouse.gov, you would actually see the federal government, the White House's plan to reopen the country. And if you look at all of the states' plans, they really do follow pretty closely to what the federal government's plan is going to be. And whether it's a first phase, second phase, third phase, fourth phase, or it's a red phase, yellow phase, green phase, what you're going to find, and as we talk about, as you and I talk together with our members today, you're going to find a lot of commonalities across all of the states. But there's no question we're monitoring, and part of the whole phased plan is the states are reporting their data to the federal government. So we already know that if the state reopens and they reopen too quickly, or we don't put preventative measures in place, that if their numbers of infections and hospitalizations rise to a certain level, they'll have to revert from the current phase they're in back a step, back a phase. And that's truly what we're all concerned about and truly trying to prevent. We don't want to go backwards.
Right. Exactly. And one of the reasons why we wanted to share this slide with you is that as you're preparing your business, it's really important to understand the nature of your state and making sure that you're not only following the OSHA guidelines federally, but making sure that you're pulling in anything additional that your state is asking you to. So there's been many federal law alerts. There's been 2 federal acts, the FFCRA and the CARES Act. But what we wanted to do is pull those acts apart a little bit and take a look at where they affected other policies that you may or may have already built and put in writing to your employees. So Jonathan, if you could share some of this information on the EEO and how it pertains to perhaps some of the members that are on our call.
Right. So most of us who have over 100 employees, we're used to filing the EEO-1 report. These EEO filings, and this just came out, have been delayed. So EEO filings will be delayed until 2021. And you can see there that 2021 in March, that's when you can expect to start filing your reports. And then January 2021 for EEO-3 and EEO-5 for 2020. So this is an example of various pieces of legislation and compliance that is being impacted and affected because of the COVID-19 pandemic and people's ability to comply with the law being impacted because certain agencies themselves are not able to be operative. So this is a good example of one.
And then moving on to others and how COVID-19 has affected business owners and compliance and what needs to be done. There's a lot of talk around the Americans with Disabilities Act and how that's going to play into bringing the employees back into the workforce. And there's just some questions that we're hearing a lot about. So if an employee has a request for reasonable accommodation from their employer because they have one of the medical conditions that the CDC says may put them at higher risk for severe illness of COVID-19, how does an employer handle that?
Yeah, truly, this is where our concerns come in and where it gets confusing, where our clients have multiple vendors. So you may have a benefits broker, you may have a payroll provider, you have an accountant, you may have a labor attorney, you may have a financial advisor, you've got vendor relationships. Everything that is happening right now is people related. It's human beings becoming infected or knowing or caring for somebody who has become infected, with this highly transmittable disease that is particularly dangerous for certain vulnerable populations. And so when we start to get into what the ADA says and reasonable accommodations, it becomes an entangled web of figuring out what the employee's rights are, what the employer is required to do. And so if we do have an employee, and these are circumstances we're dealing with right now, we've got clients that have the PPP loan, they've got an employee who's making more money on unemployment than they were on our payroll, their family member has COVID-19 or they themselves are sick. We've got to be tracking the pay and leave laws of both the state and the federal government. And then we actually have to have a conversation about reasonable accommodations if they are expressing fear, concern, or they themselves are impacted. So the reasonable accommodation part of ADA can be particularly tricky.
It is really tricky. And you know what the I don't know what happened. You know what the ADA, it's interesting. And just for those on the call with us today, that federal law is for all employers that have 15 or more employees, whether they're full or part-time. And basically what the ADA says is that you will not discriminate in an employee the opportunity to work for you if they can fulfill the essential functions of the position. You'll have to make reasonable consideration for them. But what I've seen out there is that in reality is that there aren't a lot of businesses that have up-to-date job descriptions. So their job descriptions aren't denoting the essential functions of the position. But with everything that's going on now and whether employees come back and don't come back and how this all plays out, I think now might be more important than ever that job descriptions are written and the essential functions are duly noted on those job descriptions, certainly for any employer that has more than 15 employees. Jonathan, would you want to add anything to that?
The only thing I would add is when we're working with our clients, we really try to diffuse highly emotional situations that can occur sometimes between employees and employers. We haven't even begun in many instances to open up the non-essential businesses. And so what gives us a lot of concern is when vendors, delivery, chain supply, when other people are coming into our business, this can become a highly emotional environment. And people who are concerned for their own wellness or becoming severely ill, or they themselves have suppressed immune systems, or somebody at home that they care for, maybe it's a child, maybe it's an aging parent, it can become very emotional. And there is an interplay of laws like the Families First Response Coronavirus Act, the CARES Act. There's a lot of legislation, both at the federal level and now coming at the state level, that interplays with each other. And what we want to do most is we just want to provide good information to our employees, have a great employee communication plan, and realize that we'll deal with the situation and we'll deal with it effectively.
Right. And in the COVID workplace impact, there's 3 different areas that we think are really important to pre-plan, to get in place for the business moving forward with the COVID-19 And then also moving forward with any pandemic or any infectious disease or anything that affects businesses like that. So there's a plan in place for them to work with.
Yeah, no question. We already mentioned how difficult this is for many of our clients that are dealing with unemployment and the Pandemic Unemployment Assistance Program, which is what we all know is that extra $600 on top of the state unemployment. And the way that interacts with the PPP loans, as well as, people dealing with COVID-19, we already seeing in many cases, Georgia being one case where it's pretty aggressive in its reopening plan. And the data and what we're actually seeing is that people are a bit skittish. Even though businesses are reopening, people aren't necessarily flocking to go back to that movie theater. They're not packing into the arena or the stadium. They're not going out to eat and dining inside dining rooms. So we are expecting some kind of measured, modest rebound from, economically, and we are seeing the supply delivery, the supply delivery chain impacted, and we are seeing our commerce is continuing to shift and be affected across some of the states that are pretty aggressive in reopening.
Right. So as they're looking at the policies that they currently have and the procedures of how to handle things, one of the things I think of top of mind is going to be the increased absenteeism. And I think we're going to talk about that in the future in additional slides, but making sure that there's a written policy around absenteeism and how the business feels about it, their philosophy, to alleviate some of the fears that the employees have about taking it. And also communicating what some of the benefits that are in place for the employees, and then addressing the interruption. If there's an interruption in supply delivery, what do we do? How do we handle it? And having built plans, strategic plans in place for that, along in case there's a change in the patterns of the commerce. And if you do need to do hours shifts change and different areas are there. So one of the things we're strongly encouraging is that you sit down with your business and strategically take a good look of who's looking where and what the policies you have in place to communicate to address these type of issues.
Yeah, there's no question, Sue. We formulated pretty much what looks like a 12-step plan, if you will, to reopening. And this is one of those black swan events where everybody that owns a business, unless you are an in-demand essential employer, which is a smaller percentage of the business economy, everybody's been impacted. Most of our clients are minimum impacted 50%. Many of them their doors are completely shuttered that we're working with. And I would say we're probably only through about 3 steps of the 12-step phases. Determining when to reopen your physical workplaces, deciding who to rehire or recall off of furlough or to bring back from termination because now we might have PPP funds, or our state is reopening, so we're just getting ready. And then finally, how we're onboarding and rehiring those employees and how we're resuming benefits and beginning the process of getting going again. So we're probably really only at 3 steps of a 12-step process with many of our clients.
Right. So we've identified 4 areas of workplace controls, and we'll get into a little bit of the specifics on these, some more than others, because they really pertain to your employees and HR best practices. So as we've moved forward on these 4 places, we'd like to first share with you what the engineering controls will look like. Tara, if you can go to the next slide. Yeah.
Right. So engineering controls, this is one of those areas where we don't hold ourselves out as necessarily subject matter experts, but we talk about it because this no question is part of your OSHA concerns. But your particular industries, and we have many associations that we work with, you have specific industry requirements. So I mentioned aluminum dust earlier for anyone who polishes or grinds metal. That's obviously a pretty big hazard. If we're ever dealing with chemicals and mixing chemicals, it's obviously a very big hazard. They could both be toxic, but they can both be combustible as well. So things like installing high efficiency air filters, increasing ventilation rates in the working environments, installing physical barriers like plexiglass or dividers, installing drive-through access for customers or they're not allowed in. For example, my local Best Buy, you pull up, you tell them what you need. You don't even go in the store, they just bring it out. And then specialized negative pressure ventilation for maybe those businesses that do have the aluminum dust and need to have an exterior negative pressure ventilation system. But that's not really what is primarily our concerns with OSHA and the CDC and the administrative controls.
Right. So the administrative controls is HR relevant, and this is our area of expertise. So during this, if you have questions pertaining to any of this, don't be afraid to put them there. Because if you're thinking, obviously, if you're thinking them, so is everybody else. So on the administrative controls of dealing with your employees and bringing them back to work, let's go through all of these, Jonathan, and your thoughts surrounding them. Jonathan, did I lose you?
No, I was on mute. Sorry about that. So from an administrative control standpoint, we've got a lot of concerns, specifically around people coming in sick. It's pretty obvious that we encourage them to want to stay home. But sometimes it's hard to do, right? Because they might be an essential employee or the culture of the organization might be the type of culture to tough it out or to, from a bullying standpoint. And so we just want to make sure that as owners of our businesses, we're very, very attuned and actively listen to employees who are expressing concerns. And we do want to have that open dialogue and that open door policy. Some of these other administrative controls, they make reasonable sense, but they're not exactly always easy in practice to employ. So the idea of minimizing contact between workers and customers is all well and good, but it also creates some awkwardness because we are human beings and we're social. And, that might be more difficult to actually put in place. But it's all part of the greater scheme. Anywhere we can, where the essential functions can be done virtually, we should be considering, how to do those, virtually and continue. That's part of the federal and the state plans. And then telework and remote work. I think we're going to see a major sea change, and we're already seeing it happen. I believe I read this morning that Twitter is not going to require the majority of their non-essential employees to ever come back and work from the office. It will be completely up to them to telework and work from home. And I think people are starting to really see that work is an activity and it's not a destination and it's not a place. Now, there are companies where essential jobs are going to require people to come into the shop, the location, the storefront, whatever it is. A couple of other things, we're not expecting non-essential travel to pick up until at least phase 3 or phase 4 of most of our states. And I think a big one is developing an emergency communication plan. This is going to be different for all of us as employers because right now we may not even have all of our people's email addresses in a central repository. But if we do have an incidence of an employee with COVID or somebody in their vicinity that has COVID, we are expecting employers to have to report to the Department of Health in our respective counties and be able to perform contact tracing to let other employees in our organization know we've had an incident of COVID. And so the emergency communication plan and those procedures of quarantining an employee up to 2 weeks and having a doctor's note to return, while it's new and it's awkward and it's frustrating, I think in time we're going to get this down and we're going to be really prepared and we're going to be able to jump into action once we have these things built.
And then lastly is providing for the employees and protecting them. I've been talking with a Mid-Atlantic dry cleaner, a larger dry cleaner, and how prepared they are with their equipment and clearly how much time they've taken to make sure that they've got everything in place to keep their employees safe. was quite impressive. And certainly the one thing that jumped off the page to me at that was the importance that their employees play to their operation and the care they took to put their whole PPP policy into place.
Yeah, Sue, and in speaking with one of our clients who's a dental practice in one of our states, ordered PPE masks for the office and received word that they weren't up to the required standard for dental practices because they have their own industry standards as well. But you know what? The employees, they said, boss, we understand you're doing your best. This is a very difficult time. But you know what? It's always the one or two bad apples in the bunch. And that's who we're really trying to guard against. It's not the majority of our employees, who are all in this, feel like we're in this storm together. It's the one or two that goes, I gotcha, or is trying to game the system. And you know what? It's a reality. Been in HR for 20 years. Everybody on the call, we can probably figure out one or two people we've come across that wanted to take advantage of a situation. And really, that's what we're trying to guard against.
Right. And so one of the steps to reduce risk is all around preparing some written communication and just being consistent and making sure everyone's playing out of the same playbook, if you will. So developing a disease preparedness plan. By OSHA standards and compliance, you're going to have an infectious disease policy. So this ties correctly into that. Preparing and implementing a basic infectious prevention measures goes to how, so all these things are tying back around and tying in together, goes right into the PPE protocol of what you've put in place and how you're going to handle that. And then developing your policies and procedures for identification of sick people and how your employees are going to communicate back to you if you're sick, they're sick, and how you're going to communicate to the others, because everything's starting to play into one another. So we don't want to break any HIPAA requirements by communicating someone that had coronavirus, but we need to communicate it. So there's all these things that need some forethought and some documentation prior to having the whole workforce back in. And I know for many of you, you've had your employees working right along, but these are the type of things that we're looking for businesses to incorporate or develop if they haven't had these there in the first place. Anything you'd like to add to that, Jonathan?
Yeah, and you tied it back to PPP. I always have a difficult time with PPE and PPP. PPP, our concern there is bringing employees back, and putting them on payroll is very different than bringing them back to work. So we all know if we have a PPP loan, we've got to be at the 75% payroll cost, 25% non-payroll cost. The interplay that comes in here is we have to be prepared to not only add them back to payroll, we have to understand if we're prepared to actually bring them back to work. And then, yes, if we do have an employee who has COVID or is caring for somebody that has COVID, we're going to need to have that quarantine procedure in place. We're going to have to follow all of the leave policies, the FFCRA. There's just a interwoven, area of liability there. And at the end of the day, we just want to run our business, pay our employees, and get back to normal as soon as possible.
Right. So then here are some additional steps to reduce the risk. We're recommending, and you probably already do, have one workplace coordinator who's responsible for HR and for COVID-19 in the workplace. The policies need to be looked at because most businesses did not have a policy around the Family Medical Leave Act if they were under 50 employees because they did not need to comply with it. And today you do. So we're strongly encouraging you to take a look at your policies, make sure that you're incorporating what's part of the FFCRA and the CARES Act, and make sure you have policies on leave, how telework is going to work, and employee compensation. Because one of the concerns with the work at home is where does the workday start and where does the workday end? and then the compliance with the Fair Labor Standards Act. So all the federal and state labor laws are so intertwined. It's making sure that you're recognizing each of them as you're building your policy. On the leave policies, be flexible and non-punitive. Address sick employees staying home and your business's philosophy around that. Leave policies should also account for employees who need to stay home for their children if there's no school or care for sick family members. And once again, the pay for that is going to come out of a different bucket than your PPP funds. So we want to make sure that business owners are taking advantage of everything that's available to them. When possible, use flexible work sites. Allow for employees to stay home, because if they're allowed to stay home and work, then their work never gets interrupted, if you will. So that could be in the best interest of your business. And if not, there's going to be responsibilities and policy and communication around social distancing that you need to follow that's been recommended by state and local health authorities. Anything there, Jonathan?
No, I would tie it back also just to the Americans with Disabilities Act, and if we have any concern about employees who have, immune system issues, or they are caring for somebody that may, that's where it gets really tricky, because the standard is for the employer to shoulder the burden that we have communicated and done everything and made every possible reasonable accommodation for that particular employee. And one thing that's important to know about the ADA, employers, if we do have an employee or two in our organization that we feel would be put in danger by bringing them back into the workplace, we need to be very careful with that. We don't want to be too proactive with taking care of somebody else's medical situation or medical condition, or just their age. And the reason for this is it could be deemed as adversarial to the employee. We got to be very careful with the Age Discrimination in Employment Act, the ADEA, as well as any other Title VII Civil Rights Acts. And while we are intent and our heart is in the right place, no good deed goes unpunished. So we don't want to be too proactive and too action figure when it comes to any of this. So the employee must come to us and express their concern, whether it's just general fear and anxiety, or they themselves are sick, or they're caring for somebody who's sick. And then we go through the active listening process. And then we consider whether they're essential or non-essential. And then we consider any kind of reasonable accommodations that we can make for that employee. So there is a few steps we need to cover.
Absolutely. And you know what I would encourage to those that are here, and I really appreciate you being part of our webinar today, is please ask your questions. Do you have questions around different policies that you'll be writing for the first time? Or do you have any questions around the, let's stump Jonathan. I don't know if you can do it. I've been trying since I've met him. But if you have questions around this and best practices with HR, please don't hesitate to ask us. I think some of the best dialogue on our webinars comes from the things that you're thinking about and your areas of concern. So as it pertains to this webinar, if you have questions around OSHA, communication, federal and state labor laws, please let us know. Oh, we got one. Will we be able to take employees' temperatures? Do we need to have employees sign off that the consent to this, or can they deploy this practice?
Yeah, there's no question that we are getting that often with our clients. And yes, you certainly can employ the use of a thermometer for not only your employees, but also any customers and vendors coming in, or delivery people coming into your work site. Now, the general rule, and this is just kind of like going back to kindergarten and being inclusive, is if you're gonna do it for one, you need to do it for all. We don't want anybody being able to say that they were discriminated against. If it's a standard practice of ours, then let's make sure that that becomes part of our infectious disease policy, so we can revert back to that. and that all employees have signed off on the infectious disease policy and the handbook, and that they know it is now going to become part of our standard process. What's interesting is there are some providers out there who have come out with time clocks that also read temperatures. And so that's something that we're looking into as well. Technology can really help us in some of these situations. So, thank you for the question. We just want to make sure that if you're taking somebody's temperature, we're doing it for everybody. And we should go back to making sure that we have somebody designated as the subject matter expert, whether it's somebody within your organization, it's Puzzle, it's another consulting firm, but somebody should be a workplace coordinator for everything COVID-19 and safety related. So many of you may already have a safety officer. We're going to want to make sure that they get more training on this and that they can operate within the local, state, and federal laws.
Right. We just got another question, Jonathan. Customers that come into our business, do we do anything special for them?
Well, absolutely. So again, if you're going to use thermometers and take people's temperatures, you can certainly do that. There's also social distancing. You might want to limit the number of people who can come into the workplace. We also may want to post signage, at the entrance, stating that anybody that has a fever, we do take your temperature. So posting signage and notification can be a big one. You also may, send employees home, or refuse people entry. As long as, again, we're staying within the state and federal law. If you have union employees, we just need to make sure that you're following your collective bargaining agreement. And under the National Labor Relations Act, employees can come together, even if they don't form a union. They can come together and congregate to bring their concern about the business forward without any retaliation. So we also want to be mindful of that. But I think we can post signage. We can also take temperatures, and we can at a minimum enforce social distancing rules. And as well, I don't mean to leave, and I also don't mean to leave off. You also can require your PPE standards that you have for your employees. You could also require that of vendors and customers alike. You can refuse service if they're not following the CDC guidelines and the local, state, and federal guidelines for PPE.
Excellent. Okay, thank you. So in the employee communications, the communications that you do to your employees, we want to make sure that they meet any state and federal labor law. That's important. And figuring out which of the labor laws takes precedent over the other. And I think a very good rule of thumb here is in laws that are more employee friendly trump the less employee friendly, if that makes sense to you. You need to communicate things that are vital to the organizational management of your business and to have strategic plan put in place right now. Also, a purpose is to update employees on new policies, which there are under the new acts. So we want to communicate the new Family First and being able to take time into 6 categories of employees and exactly how they're going to get paid. I think you will find, and this might be a time that we kind of sit back and start writing policies and, notice our handbook and get them updated. But I have definitely found in my 30 years of doing this, the better the communication is in the business, the more effective that management is. And I think one thing that might be of interest to business owners is it's really important that your managers are trained and that they're actually all singing out of the same playbook. And there's some continuity across the organization of how things are communicated and taken care of. Jonathan, did you want to add anything to that?
Yeah, a couple of things. I think, from a practical application standpoint, we want that company safety officer, to handle any employee concerns. We want to encourage a culture of open door policy so that they can bring if they're infected, they can bring those concerns forward. Communication regularly shows the organization has a plan forward and a serious commitment to keeping the incidence of COVID-19 out of the workplace to the best we can. And then making sure our frontline supervisors and managers are properly trained to recognize signs of and any areas of concern with infection. There are many more points that we can talk about, but these are real practical things that you can put in place. We are monitoring whether or not COVID incidences in the workplace will need to be reported on OSHA 300 log. It's not required today, but we'll see if that changes and we'll report back.
Your infectious disease policy is definitely a policy that needs to be added to your employee handbook. It is part of OSHA requirements to have a written infectious disease policy to your employees. So always best practice would be to make sure that your employees are signing off on it. But there are some specifics to your infectious disease policy which are outlined in the slide. And Jonathan, would you like to go through this or add anything to it, or do you think the slide speaks for itself?
The slide generally speaks for itself. The one that I find very interesting is we all know how our organization is set up. We know where the break room is. We know where people typically congregate around the water cooler, and it's going to be very difficult. This is going to be awkward because as we want to come back together and we want this to go away as much as we do, the practical reality of this is we need to make sure that we're all rowing the boat in the same direction. And that's where the infectious disease policy comes in place. That's where we train on that. We talk about it, but we make it real for them. We want our employees to understand this is a period in time. This is not forever. This is a period in time. And we just need to do what we need to do today and maybe for the next few months until we get a vaccine, until the coast is clear. And by the way, until the next one comes around. So I was in the military. I was in the Marine Corps for 8 years. You get woken up in the middle of the night for a training exercise you weren't necessarily ready for, but you snapped in and you were ready. And that's what a lot of this is about. It's about preparedness and having a plan.
Right. And then the other policy that probably wasn't in most handbooks prior to COVID-19 was the remote work policy. And there are so many reasons why, if it's not in your current handbook and people are working from home, it's really important for you to get some of these things in writing. I mentioned a few of them. The Fair Labor Standards Act, in most cases, you have to pay for all hours worked unless they're truly an exempt employee underneath that. And if that is the case, that needs to be written into your remote work policy on the expectation of clocking and logging hours. And then there's other things. The remote work agreement form to your immediate manager for departmental approval for any eligibility requirements to be able to work from home. If you're granted remote work arrangement, you'll be subject to the same performance standards as prior to work. So if you do have remote employees working for you, you want to think about exactly what they could be doing and what your requirements are going to be around that, the hours they're working and how they're keeping track of them and exactly what they're doing.
Yeah, no question. The remote work policy, it may or may not work in many instances where the employee's functions have to be performed, at the work site. I will say, for purposes of general duty clause under OSHA, we must provide a safe and healthy workplace. But running our businesses, that's really where we're concerned about making sure that the business survives and the business can continue, and advocating for both the employee and the employer to come to a reasonable accommodation where we need to do that, and everybody, is operating under local, state, and federal law. But at the end of the day, the business needs to survive and operations need to continue. We just need to operate within the rules of the game.
And it's really funny because I maybe I'm the only one that thinks it's funny, but the whole wide world's printing posters on washing hands. But we just wanted to, state the obvious here there are actually posting requirements around washing hands in the workplace. I know they've always been there in the restaurants that they had to do that, but this is the first time that I think you're going to see it in all workplaces. And that's where the slide came from, is although we think things are obvious, I think sometimes as business owners, we have to take a step back and make sure that we're communicating everything to the employees for both their safety and understanding and expectations.
I don't think I have anything else to add to this slide.
You don't. Okay. I know it's a crazy one, but it's like you have to put it up there. Everyone is.
Listen,
very often you're restating the obvious. Yes.
Hang around the mall long enough, and you'll see why we actually have to put that slide up.
All right, and then on the PPP, PPE. Yep, you're right. I have the same problem.
It's hard.
Jonathan, yeah.
Oh, okay, no problem. So yeah, PPE, very basic requirements here, right? So we have to assess the hazard, assess the situation, and make sure that the proper PPE is offered. It's got to fit correctly. We should be monitoring that it's consistently worn. Regular inspections. I get it, right? Sometimes, in the workplace, the safety officer is the one that is got the clipboard and the pencil and is giving you an infraction for violating this. We all know how this all really works in the workplace, but again, it's all communication, and the better we communicate and the more leadership we take, we've all seen injuries in the workplace, and if it could have been prevented, it should have been prevented, and that's all we're really saying here is make sure that we're wearing the right PPE, we're following local ordinances, we're following our industry associations and our industry OSHA's recommendations on PPE, and that we are working jointly and together on advising on any infractions or incidences.
Okay. And then lastly, because I do believe this is our last slide, and then we can open it up and answer any questions. I bet if we open it up to the PPP loans, we'll get questions. Is all around, it's all around communication. So with the COVID-19, there are new expectations for employers. There's policy expectations, there's procedure expectations, and communication expectations. And so these are all new posters that you're expected to have up in your workplace, and then guidance on preparing your workplace, whether it be where you're going to have the sanitizing soap, whether you're going to be the 6 feet apart from each other. All across the board, there's required postings, policies, and procedures. Right. So I kind of want to just, before we open it up to PPP, I kind of want to, I alluded earlier to, 12 steps that I think every employer needs to be putting in place and that we're working with our clients on. So, if you want to jot some of these down or follow up with us afterwards, really we need to determine when to reopen, our physical workplaces. Some of us may already be open. So now we're deciding who to rehire or recall and in what capacity, determining who's essential and who's non-essential. We need to go through the process of onboarding and recalling employees and going through all of the re-verifying that any information has changed since, we last talked 2 months ago, benefits changes, life events have happened, people have had babies, all kinds of things have happened in people's lives over the course of the last, 2 months. So we have to get back on the same page with them. We also need to focus on making these accommodations, for our employees and making adjustments within our workplace. I would say number 5, figure out our plan for screening our employees as well as our visitors that are coming into the workplace until we have a vaccine for COVID-19. And then number 6, handling how we handle our confirmed and suspected cases of COVID and how we're actually reporting that to the Department of Health
and to OSHA, and putting it on the OSHA 300 log. 7 is we're making sure we're all buttoned up on the required use of PPE and our safety protocols and our safety program, for our clients, and then promoting your employee hygiene, making sure they have the sanitizer available, making sure they have a wash, a place where they can wash their hands frequently. We also should consider maintaining our sanitary and clean workplace. So if we have an infection, who are we going to call to come in and do a deep scrub and a deep clean of our workplace? And then having a social distance policy inside of our infectious disease policy, making sure that that we're handling that. And then finally, addressing any of our employee concerns and navigating all of those tricky local, state, and federal laws. So with that, with those steps, I'll turn it back to you, Sue.
Okay, absolutely. And in wrapping up, what we wanted to talk about today with bringing your employees back to the workplace is in your PPP loan, and whether you did a PPP loan or you didn't, they are expected of you. But in your PPP loan, you did sign saying that you will be compliant with the OSHA standards. And just to make you very much well aware that there have been some changes. And depending on the state that you're doing business in, each state is different. Each employer with what your jobs are different. But to make sure that you have your eye on the ball with OSHA and the expectations. The second is the communication, whether it's communicating to your employees that you're expecting them to come back to work, whether it's communicating with your employees, the new federal and or state labor laws that come out of this. I've only seen federal so far. But it's just your communication policies, and make sure that they're rock solid for you. And rock solid, I'm sorry, I'm trying to read and talk at the same time. Can't do that. But your communication policies. And I believe that's it. We're happy to answer questions on this. We are getting a few, and of course, we are getting some PPP loan questions. The first one is, what is the measurement period that PPP will use for FTEs?
Your FTE calculation will be the 8 weeks from the date of disbursement, the day you receive the funds.
Okay. And then also, will the EIDL grant money become part of the PPP forgiveness loan?
Yes, the EIDL grant, the $10,000, the SBA restricted the grant from $10,000 to $1,000 per employee up to $10,000. If you got the EIDL grant plus a PPP, they will be blended for your maximum loan forgiveness.
Okay. And then, Jonathan, you just answered about the postings required in Spanish?
Yes, we can certainly help you with Spanish posters. Okay.
That's perfect. So as of right now, I do not have any additional questions. I hope you found this to be informative. At a minimum, thought-provoking. There's a lot of work to be done from what we've seen in a lot of businesses when it comes to the HR component of communicating and bringing the employees back and being set with the new expectations. And, we want to make sure we can answer any questions that you might have on that, or what is expected of you. A question just came in. We received our PPP, but our state and county remains closed down. Will I need to bring all my employees back even though there's no work, or can we keep some on furlough?
So yeah, some of my closing remarks were going to speak exactly to that question. So today we are at the last day for us to file a safe harbor claim with the SBA and the federal government if we took funds and we actually didn't need them because financially we were actually okay. So we all know about $450 million has been returned from publicly traded companies where they had access to other capital liquidity. So today is the final day for the safe harbor to return the funds if our company was not impacted negatively by COVID. I'm assuming everybody on the call has been negatively impacted. Secondarily, tomorrow is the day the SBA will conclude its period of public commentary, where we all have the opportunity to send in our comments and feedback on how the PPP loan was was operating for us. We're up to 47 FAQs that the SBA has put out there. Tomorrow, the period of public commentary concludes. And next week, we're likely to have more information specifically on the final rule and how loan forgiveness will work. And lastly, if you're not familiar with the haircut test as it relates to FTEs and loan forgiveness, let's be sure to connect after today's webinar and let's have a conversation specifically about your loan forgiveness and your organization. We'll assist you with the haircut test.
What's the haircut test?
So interestingly, Sue, one of the FAQs came out during the period of public commentary, and businesses, especially some of our other associations, dramatically impacted by the unemployment $600 on top of state, making it very difficult for us to bring employees back on payroll. So specifically, the SBA came back and said, as long as we have a good faith effort and documentation that we put together and get it in the forgiveness package that we send off to the bank, we can get those FTEs that you couldn't get back on payroll forgiven and not be counted against you for loan forgiveness.
Oh, that is going to be key. And so many times I've heard business owners saying that they were going to phone call the employees back. If one piece of advice today I think is really important, that needs to be a written communication, and you need to make sure that you're writing it carefully, because as Jonathan is saying, to have that included in the FTEs will be very helpful to you with the forgiveness. Well, it is now just about 2 o'clock. I appreciate everyone attending and staying with us. If you have any additional questions, oops, we got one more while we close here. Oh, somebody said thank you. You're welcome. We really appreciate being invited to be part of the group, to get in front of you. Any questions at all, please don't hesitate to ask, and we look forward to working with you. Have a great day.
Thank you, everyone. Bye-bye.
Bye-bye.